Assisted Transportation in March open enrollment meeting for 2024. My name is Scott Flores. I'm the Vice President of Operations, and I'm excited to share the new benefits available, who qualifies, and when they are available. I would specifically like to reference our part-time employees like our drivers and aides. Excited to present that we now have available dental, vision, basic and voluntary life insurance, and an employee assistance program. And these benefits will now be available to everyone. Everyone will qualify. They will be available to start in January of 2024, and they will also be offered to new employees at time of hire. We will still offer the health insurance as we have in the past, and you still must meet the eligibility requirements to qualify, but definitely some new benefits that are available to take advantage of. Even if you're unsure if any of these benefits would work for you, I would definitely encourage you to take a look. That being said, I would like to introduce you to Jennifer West. Jennifer is our client service manager, and she works with our broker, Highland, and she's going to walk us through the benefit process. Good morning, Jennifer.
Good morning, Scott. Thank you. Good morning, everyone. Thank you for being here. As Scott mentioned, my name is Jennifer West, and I represent Highland, your dedicated broker for employee benefits. Today, I'm excited to walk you through the comprehensive benefit guide, ensuring that each of you are fully aware of the fantastic offerings that Assisted Transportation and March have acquired through its recent partnership with CRISE and American Student Transportation. This collaboration was designed to enhance and expand the benefits available to each and every one of you. Everyone should have received an email outlining their benefit classification, including a digital copy of the benefit guide and links to the March and Assisted microsites. Should you require additional information about any of the benefits discussed in today's presentation, I strongly encourage you to visit the microsite or reach out to Scott and I. This summary page contains details about all of the employee benefits provided here at Assisted in March, and it serves as a vital point of contact about your medical, dental, vision, life, short-term disability, flex spending, and EAP carriers. It includes their names, contact, phone number, and websites. If at any time you have questions about the plans, need assistance in understanding your benefits or coverage, encounter any issues with claims, or have general inquiries, please reach out to Highland's customer service team at 1-866-740-5550. Now let's dive into the heart of the presentation, the comprehensive benefit guide. Our goal was to ensure that every employee is not only aware of the benefits, but also has an understanding of how these offerings positively impact their lives. Open enrollment period for March and Assisted Transportation is now through December 11th at midnight. During this crucial time, all employees are required to participate in what we call an active enrollment. It's essential to note that none of your existing plans or coverages will automatically carry over due to the introduction of new benefits in the revamped system. Without making your elections before the close of open enrollment, the coverage you currently have may be canceled and interrupted. For any inquiries, again, Scott and I are readily available to provide you clarification on eligibility or benefit details. It's also important to note that the March and Assisted Transportation, we're using the same platform this year, which is called Employee Navigator. However, please be aware that it's operating under a different license this year. So your old usernames and passwords are now obsolete. So if you use your old username and password to log into the system, it will tell you that your profile cannot be found. To access the system, either follow the link in the email you received from Employee Navigator or refer to the instructions in the benefit guide or on the microsite. Again, if you have trouble getting into Employee Navigator or finishing your benefit elections, please reach out and we are more than happy to assist you. March and Assisted Transportation proudly offers a comprehensive health and welfare program not only to full-time employees, but to its part-time employees as well. In my 15 years of experience, I just want to point out that it's noteworthy that I've only had about a handful of employers that actually provide benefits to part-time employees. I think this really is a commitment to the company's culture and how they put their employees first. It's a little bit challenging on the back end with administrative work. However, it's heartening to see that both full and part-time employees have access to coverages at a group level, primarily because it's more cost effective to you. If you qualify for medical coverage under the March or assisted policies, they allow you to cover your domestic partner, legal spouse, and/or dependent children. For those employees that are opting for medical, dental, or vision, or voluntary life, please note that dependent children can only be covered up to the age of 26 on these policies. And then I just want to mention your COBRA rights. Even if you were enrolled in medical, dental, and vision, just for one day, you are entitled to COBRA continuation rights. This means that you can carry this insurance with you in the event of your departure, but you would be responsible for covering the full cost of the insurance. Again, medical benefits are only available to full-time employees and part-time employees who are medical eligible, which means consistently working 30 or more hours a week. All right, making changes throughout the year. Again, currently we are in the midst of open enrollment, which is the designated period of time that you get to make changes to your health insurance and your elections. It is essential to understand that during this time, your choices are locked in and you will not be able to add or drop coverage until the plan renews in September of next year. There is a caveat. Unless you experience a qualifying event, which is listed here on page 5 of your benefit guide. Qualifying events include marriage, divorce, birth or adoption, death of a dependent, change in spouse, employment, gain or loss of coverage, and entitlement to Medicare or Medicaid. As you navigate through your benefits, one key step is to designate a beneficiary, which you will see down towards the bottom of this page. This ensures that in the unfortunate event that something does happen to you, your benefits are directed per your wishes. I want to highlight that everyone is provided an employer-sponsored life insurance policy. And in addition, if you elect to have a HSA account with EBC, that does include a payout to your beneficiaries. Again, beneficiary designations do not need to be updated during open enrollment, but they can be updated at any given time in the year should the situation change of your should the situation of your beneficiary change. Okay, medical coverage is through Highmark Blue Cross Blue Shield, and there are 3 plans. Again, these 3 plans or medical coverage is available to full-time or part-time only employees. The plans are the 1,000 buy-up, 2,000 base, and the 3,000 HSA plan. The plans cater to different needs and coverage levels and will vary in cost to suit diverse employee requirements. The HSA plan features a $3,000 deductible, 80% coverage post-deductible, which is called your co-insurance, and then a $5,000 maximum out of pocket. You will see that all services on this HSA plan, including prescription drugs, are subject to deductible and co-insurance. Employee Benefits Corporation, or EBC, is our preferred vendor and provides our HSA funding accounts if you would like to set up an HSA funding account with your HSA plan. It's important to note that you should map out your medical needs for the year when funding your HSA, because this will ensure that sufficient funds for potential medical expenses are available within your HSA account should you experience a medical need. The base plan operates on a fully insured chassis, and it features a $2,000 deductible, 80% coinsurance, and a $5,000 individual maximum out of pocket. So just to clarify, your deductible is the amount of money that you must pay out of pocket for any service that is allowed deductible and coinsurance cost share. The coinsurance is the portion of the bill that you pay after you've met your deductible, and then your maximum out of pocket is worst case scenario. Should you become very ill, get diagnosed with cancer or a major medical illness, or have a major accident, that is where you stop paying medical claims for the policy year. But you'll see that there are set copays on this plan for primary care, specialist, preventative services are covered in full on all three plans, virtual visits, urgent care, and emergency room. So you will see that a copay, you will pay that cost in lieu of paying towards your deductible. So in essence, a copay will trump your deductible. You will see for services such as major diagnostics, labs, x-rays, hospitalization, and outpatient surgery, you would be required to pay your $2,000 deductible, then 20% of the bill, up to $8,700, which is your max out of pocket. There is a 3-tier formulary or approved list of drugs for prescription medications, and they are either $8, $40, or a $70 copay for a 30-day supply. On the $1,000 buy-up plan, the plan includes a $1,000 deductible, no coinsurance, and an $8,700 maximum out of pocket. This plan also has set copays for primary care, specialist, preventative services covered in full, virtual visits, urgent care, and emergency room. You will also see, just like the base plan, major diagnostics, labs, hospitalization, and outpatient surgery would be subject to your $1,000 deductible. This plan has the same prescription drug tiering, so a 3-tier formulary or approved list of drugs, and a copay structure of $8, $40, or $70 for a 30-day supply of medication. It's also important to note that all three of these plans have out-of-network benefits, so they operate as a PPO. But it's also important to note that the deductibles for your in-network and your out-of-network services accumulate separately. So for instance, if you have one on the buy-up plan, you have a $1,000 bucket of money for your in-network deductible. And then you can see down at the bottom, there's a separate out-of-network deductible, which is $2,000. Now, if you seek services from both in-network and out-of-network doctors, you could potentially be paying a deductible up to $3,000, because all out-of-network claims go to the out-of-network bucket of money towards your deductible, and then your in-network claims will go to your $1,000 in-network deductible. The same concept is applied to your out-of-pocket max. So any in-network claims are applied to your in-network out-of-pocket maximum, and all of the out-of-network claims are applied to your out-of-network pocket, or your out-of-pocket maximum. So just to be clear, I do sometimes get inquiries saying, I thought I've paid my $1,000 deductible. Why are some of my services still being applied to a deductible? That's typically why. Again, you do have out-of-network benefits on all three plans, but if you seek services from an out-of-network provider, You could be subject to balance billing, which means that if the doctor gets reimbursed from the insurance company and their services were more than what the insurance company reimbursed, they can send you the bill for the difference. Payroll deductions are detailed in your individual guides. However, I've added both pay tables, and this is presented based on whether you are paid 26 pay periods or 52 pay periods. Your dental insurance is through Sun Life, specifically the PPO network, and you have two available plans. Um, One is called the Enhanced DPPO, and then one is called the Basic DPPO. So let's start with the basics. Both plans cover preventative services at 100% in network. For the Enhanced DPPO, basic services are covered at 90% after your $50 calendar year deductible. For major services, the plan will pay 60% after the same $50 deductible. Orthodontia is covered on the Enhanced DPPO plan, with the plan paying 50% after a $50 calendar year deductible, but only up to the lifetime maximum of the plan, which is $1,500. Now let's take a look at the basic DPPO. For basic services, the plan will pay 80% after your $50 deductible. And for major services, it would cover 50% after your $50 deductible. Keep in mind when I talk about deductibles, you will only need to satisfy the deductible once in a policy year. There are no waiting periods for services on both the Enhanced DPPO and the Basic, except for orthodontics, which has a 12-month waiting period and only covers children up to the age of 26. Here's the significant difference between the Enhanced PPO and the Basic PPO. Under the maximum benefits limit header, the annual limit for the enhanced plan is $1,500, meaning the dental company is only going to pay up to $1,500 worth of dental benefits in any calendar year. On the basic plan, the annual limit is $1,000. So just for an example, if you needed a major service like an implant, the enhanced plan would cover 60% up to a $1,500 maximum, and then you would be responsible for the remaining cost. Versus the basic plan covers 50% of the service up to a combined total of $1,000. Again, after that, you would need to cover the remaining cost for any procedures beyond that limit. Again, pay tables are down at the bottom and they are broken out whether you are paid 26 or 52 pay periods per year. Vision coverage. Your vision plan is through Sun Life as well, and it utilizes the Choice Network. Eye exams, frames, and lenses are covered every 12 months. So your eye exam is a $10 copay at a in-network provider. For your frames, you are allowed a $150 allowance at retail cost, and then 20% discount off of any overage after your $25 frame copay. Lenses are a $25 material copay, and if you need a specialized lens or want a specific coating, another copay could apply based on the summary of benefits that's located on your microsite. If you want contact lenses in lieu of frames, you get a $60 copay for the fitting and evaluation to make sure your contact lenses fit and are appropriate to your eyes. And then you get a $130 retail allowance for contact lenses every 12 months. For medically necessary contact lenses, the fitting evaluation is a $60 copay and then a $25 material copay for the lenses. There are additional discounts for glasses and sunglasses, retinal screenings, and then laser vision correction. The payroll deductions are down at the bottom and again broken out in either 26 or 52 pay periods. Basic life and accidental death and dismemberment. This is through Mutual of Omaha, and it provides $25,000 worth of life insurance at no cost to you. This is a significant benefit for employers to offer. Providing financial support to a family in the event of your passing is critical, especially nowadays where a lot of people do not have individual life insurance policies. I definitely commend March Assisted and ASTP in Christ for doing this for their employees. This will at least give your family peace of mind for final expenses. Now, if you are looking for additional life insurance, you can purchase voluntary life and accidental death and dismemberment, and this is also through Mutual of Omaha. Right now, everybody is considered new enrollees, so you are in your initial enrollment period. You can buy for an employee in $5,000 increments up to $150,000, no questions asked, or 5 times your annual salary, whichever comes first. For a spouse, so the employee, you must have insurance on yourself in order to buy coverage for a spouse or dependent child. And for a spouse, you can buy in $5,000 increments, either up to 100% of what you bought for yourself or to a $30,000 guaranteed issue, whichever comes first. Dependent children, you can insure $2,000 increments up to 100% of what you've bought for yourself. Now, there are additional amounts that you can buy above the guaranteed issue, and they're listed in the maximum box under each the employee, spouse, and dependent children header. So employee, you can buy up to $500,000 worth of life or no more than 5 times your annual salary. For a spouse, it can be up to 100% of an employee's benefit, but no more than $250,000 is the max. And then for children, it's 100% of the employee's benefit up to $10,000. It's important to note that if you elect coverage over and beyond the guaranteed issue amount right now, you do have to fill out what's called an evidence of insurability form or an EOI. We will payroll deduct the guaranteed issue amount, but until you turn in the EOI to Mutual of Omaha and you are approved for the additional amount, we will not payroll deduct the full benefit. So please, again, this is on the employee that you must go and fill out an evidence of insurability if you are electing an amount over the guaranteed issue. The rate tables are on the next 2 pages, but I can tell you that Employee Navigator does a very good job of projecting your cost for you. There is a slide bar in Employee Navigator, so you can determine how much coverage you want to buy by either the amount, and then it will list the price, or if you're looking to fit it within your budget, you can use the slide bar and up to a price point in which you're comfortable with, and it will tell you how much coverage you can buy at that price point. Short-term disability. Now, this benefit is for full-time employees only, but short-term disability is essentially paycheck insurance, and this allows the employee, should they ever become disabled, essentially anything that would take them out of work for 7 days or more due to an accident or illness. It pays 60% of the employee's weekly earnings up to $1,000 maximum, and it will pay out for 12 weeks. This is a wonderful benefit that your employer pays on your behalf. Because I will tell you, there is some point in time in your career, your working career, that you will not be able to come in and clock in for work. Not many of us have a lot of built up PTO, so this does help in even though it's a pay reduction, so it's only 60% of your weekly earnings, it's still money coming in to help pay those bills. Now, you will have the choice in Employee Navigator to have these on a pre-tax basis or a post-tax basis. Just keep in mind that there is a tax overview linked in your benefits hub that will outline the difference on whether you take it pre-tax or post-tax. General rule of thumb, if you take it pre-tax, you will, if you have to claim this benefit, pay taxes on it when you receive it. Okay, so for HSAs, your health savings and spending accounts, first is flex spending. So your flex spending account, or FSA, just allows you to set money aside from your paycheck to pay for eligible medical expenses. Dental services, orthodontia, glasses, contacts. There's a whole list determined by the IRS. If you're looking to enroll in this benefit and put some money away in an FSA, the FSA annual contribution maximum for 2024 is $3,200. And then if you need a dependent care FSA, it's $2,500 per person, or if you are a married couple, it's $5,000. Again, there's more resources and more information located on the microsite on FSA and eligible expenses. The dependent care, again, this is helping with babysitting fees, before and after school care, dependent care, nanny expenses, summer and day camp, and adult care facilities. You can be reimbursed for these, sorry guys, you can be reimbursed for this, but I do want to point out your FSA account, whether it's dependent care or your regular FSA account. This account is considered a use it or lose it. Unused funds at the end of the year will be forfeited, except for the $640 that the IRS allows you to roll over. So again, if you're checking into an FSA and that's something that you want to do, pre-tax dollars to fund some of your medical expenses, that's great. I would definitely sit down prior to funding the FSA and determine how much money you need in that account, and try not to overfund it, because if you overfund it, you either have to find a way to buy things by the end of the calendar year, or you will have to forfeit any funds in excess of $640. Now, the HSA account works a little bit differently. This is the flyer for Best Flex plan. So this is Form EBC. If you enroll in an FSA, please, please, please download the application. You'll be able to access all of your claims information, pay for your eligible expenses, and set up direct deposit. This app makes it so much easier than doing an FSA in, I would say, about 10 years ago, to where you had to physically wait for paycheck or checks to come in the mail to get reimbursed for your medical expenses. Now, your health savings account works a little bit differently. You have to be enrolled in the HSA plan in order to set up the HSA account. That is one of the caveats to this. And you can set up payroll deductions depending on how much you want to fund your HSA. Your HSA can be funded up to $4,150 for 2024 for employee only. If you're insuring employee and dependents, that's raised to $8,300. And these funds do roll over year to year. If for at any time you fund an HSA and then you choose not to enroll in an HSA, that's fine. You do not lose those dollars, but you cannot deposit any more money into the account. Eligible expenses for the HSA would be medical, dental, and vision and prescription drug expenses. And then there's, again, portability, flexibility, and tax savings with an HSA. Support link is the last benefit we're going to talk about today, and that is your employer-sponsored employee assistance program, or commonly known as EAP. I highly encourage every one of the March and assisted employees to scan this QR code and just have this app ready on their phone. We don't know exactly when we're going to need some sort of advice or legal consultation, short-term counseling. Um, but at some point we will need it, especially as the holiday season approaches. So just go ahead, download the mobile app today, just have it on your phone, and just know if there's something that comes around in your life and you just need somebody to talk to, or you need just short-term support, there are licensed clinical clinicians on call 24 hours, 7 days a week, 365 days that you can that can help with work-related pressures, depression, stress, anxiety, if you're grieving, relationship problems, substance and other emotional health concerns. Legal consultation is there, so you do get a 30-minute legal consultation. Convenience resources are also there, so childcare, adoption, pet care, home health repair, or I'm sorry, home repair, I should say. There are also virtual support connects and a whole resource of webinars and flyers for you to access. So again, that is 365 days a year, 24 hours a day, licensed clinician at the tip of your fingers if you need that support. Again, if it's something that you want to talk to, Scott and I are always here. The rest of this benefit guide just outlines important terms and then the legal disclosures within the benefit guide. At this point, I can take any questions for those that need a little bit more clarity on any of the benefits we covered in today's presentation.
I have a question just to confirm what you said about the vision and dental, the dental particularly.
Okay.
So the plan only would pay up to $1,000 total for the employee and spouse in the plan year.
So that is a individual limit. So for the basic, so if we're looking at the basic DPPO, it is $1,000 combined in network and out of network calendar year limit for each person on the plan. So it's not a family limit, if that's what you're asking.
That's for each person.
Each person, correct.
Right. The other question I had was, how are the premiums paid during the summer months when we are not having pay periods?
So are you paid on a 26 or 52 pay period?
It's paid weekly, but is off when the school children are off.
That's right.
So he doesn't get paid every single week.
Okay. We might have to work that out with Scott on how that part works.
Yeah, no, absolutely. Great question. What I will do is I'll work with Tamara Wilson. She's our VP of Finance, and she can provide some detailed information on that to respond to that question.
Okay, so we'll just expect to have a little bit more information on that then.
Yes, sir.
Okay. Well, I think that's all because as far as medical, I'm not eligible for medical, so just vision, dental.
You have any
Okay.
questions? I think that's it for questions from our side.